Recent research suggests that combining a biologic therapy with a GLP-1 receptor agonist may improve quality of life in people living with psoriatic disease compared with standard therapy alone. Psoriatic disease, which includes both psoriasis and psoriatic arthritis, is a chronic inflammatory condition that can affect the skin, joints, and overall well-being. Beyond visible symptoms, many patients experience pain, stiffness, fatigue, and a significant impact on daily functioning. Over time, this burden can affect physical activity, mental health, and cardiovascular risk. Biologic therapies have transformed the management of psoriatic disease over the past 2 decades. These medications target specific inflammatory pathways, such as tumor necrosis factor or interleukin-17, helping reduce joint damage and improve skin lesions. For many patients, biologics provide substantial symptom control. However, psoriatic disease is not only a joint or skin disorder, it is increasingly recognized as a systemic inflammatory condition, closely linked with metabolic disorders, including obesity, insulin resistance, and cardiovascular disease. This overlap has prompted researchers to explore whether addressing metabolic dysfunction could further improve patient outcomes. This is where GLP-1 receptor agonists enter the conversation. They were originally developed for type 2 diabetes. More recently, they have also been used in weight management, improving glucose regulation and promoting weight loss. Researchers have begun examining whether GLP-1 therapy might provide additional benefits when combined with biologic treatment. Emerging data suggest that this combination approach may enhance overall quality of life compared with biologic therapy alone. Patients may experience better physical functioning, reduced disease burden, and improved metabolic markers. Importantly, these findings do not suggest that GLP-1 receptor agonists replace biologic therapy. Rather, they raise the possibility that targeting both inflammatory pathways and metabolic dysfunction simultaneously may provide complementary benefits. Analyses have shown that weight reduction can positively influence disease activity in psoriatic arthritis. Researchers are investigating whether this metabolic improvement may contribute indirectly to better inflammatory control. At the same time, it is essential to interpret these findings cautiously. Current evidence comes from observational data. While results are promising, more randomized controlled studies are needed to determine durability and safety profiles. Treatment decisions remain highly individualized, factoring in disease severity, comorbid conditions, and prior response. One hypothesis is that chronic systemic inflammation and metabolic dysfunction reinforce each other. Adipose tissue is not simply a storage organ. It actively produces inflammatory mediators. Clinicians are moving toward integrated models of care that recognize the interplay between inflammation and metabolism. For patients, this approach may eventually translate into more personalized strategies aimed at overall quality of life. As always, consult a healthcare professional. For more science-based health content, follow healtalk.org.